Started. I want to welcome you to the third of our series on mental health and well-being for the biomedical research community. It's really nice to see so many of you here. This is our second year in doing this, and the continued sustained turnout and interest really illustrates how important it is for us to gather and have these discussions, to work together to decrease stigma, to increase our understanding of mental health and well-being, to learn how to support ourselves and each other in this. You know, I can't help but note that in the last week or so, whenever I say, "How are you?" To the person joining me on Zoom, that there's a pause for a moment. You know, am I okay? I think we've all been through a lot. And the more we gather and talk, the more we gather and share, the better off we will all be in the long term. Today, we're going to discuss depression and depressive disorders. We're going to have a talk and then some Q&A if we have time, followed by small group discussions. In addition, during the next month, we will continue focusing activities on providing support around mental health and mental health discussions. We'll have a webinar skill session focused on journaling and another focused on mindfulness and meditation. So those of you here today or watching the tape in the next few days will get an invitation to those follow-up events. So some large community events, but then some smaller events to continue the learning. I'm pleased to introduce Annie Shiner, who is an NIH-OITE wellness advisor and a licensed mental health provider, and she'll be leading the discussion today. Thank you, Annie.
Thank you, Sharon. And as you said, you know, asking people how they're doing, and often there is a pause and people may say things like, you know, I've been feeling kind of depressed lately. And so when we say that, when we use that term, it can mean anything from I've just been feeling down to maybe I have some symptoms of some depressive symptoms, or maybe I have a clinical diagnosis of depression. There's a whole spectrum of ways that we ascribe to the term depressed. And so we're going to do a little bit of a look into each of those areas today, and look at the experience of what that's like and some strategies and things that we can do when we're feeling that way. So we're going to start with the mildest version, which is feeling down. So we've all had that experience of feeling sad, overwhelmed, lonely, discouraged at times. Sometimes we know why we feel that way. We can identify events or triggers. It could be workplace struggles or personal life issues in our personal life, things that happen personally to us, maybe specific events that we can put our finger on, a loss, a grief, trauma, or maybe part of the larger social events that we've all been going through in this year and this century that may contribute to that. Sometimes we don't know exactly why we feel this way at this time, but we do. We know that we are feeling down. Cumulative effects of many things can contribute to that. Our own physical state is clearly a factor. And so there also may be psychological or mental health concerns that are underlying it. But mostly when we are, you know, mostly those down feelings, most of the time people are able to manage those feelings and get past them with some time and with some self-care. But I just wanted to note that sometimes the strategies that we're going to talk about, the self-care strategies, don't work, or they don't even feel doable, or they aren't enough. At that point, it is important to it's a signal that we may need extra support and help to be able to get back up. And so we will talk a lot about that later. Right now, we'll start with those basic self-care strategies. And those are the same things like that my grandmother always said. Are you sleeping okay? Are you eating right? Are you getting outside and having physical activity? Are you having any fun in your life? And also, are you allowing time for rest and relaxation? So those things are the fundamentals of self-care, and also not making the problem worse by abusing things like alcohol, recreational drugs, electronics, things that may feel okay in the moment, but end up leaving us feeling worse in the long run. Because feeling down is a mental and emotional state, it is important to sort of become aware of your thoughts and feelings as part of your self-care. So first of all, accept that you have feelings, you are human and you have them, and that's okay. Um, and then the cognitive piece is the negative thoughts and negative way of thinking that we may have. Challenge those, that inner critic that tells you that you're not okay, that you're not good enough, that there's something wrong. Challenge those thoughts and those cognitive distortions that you may have. Another useful thing to do is to pay attention to what you can control and let go of the rest, let go of the things that you cannot control. We can drive ourselves nuts trying to control things beyond our control. And again, here, it's important to not make things worse. So avoiding deep dives into those dark places in social media or the news that only feed on those negative feelings and thoughts. Another important piece of self-care is connection. So the first part is connecting with yourself in a compassionate way, treating yourself as you would a friend that you care about. Another way, another self-compassion piece can be mindfulness practices and meditations. So if you find these, try them out if you haven't, and you have an opportunity at one of our supplemental groups, and find something that fits for you. Science shows that these can be really helpful. So in addition to connecting with ourselves, we want to connect with others. So spend time with people that you enjoy and also time with people who care about you. Building and using a personal support network of friends and people in your life, and also perhaps professionals that we will be talking about in a little while. Doing something for other people as well as accepting people doing things for you, but not again at the cost of taking care of yourself. So boundaries are important. Setting and upholding healthy boundaries in your personal relationships. The third connection is nature and the natural world. So spending time outside and enjoying and connecting with nature. And then lastly, connecting with the positive in your life and in the universe. So a positive sense of yourself, developing mastery over things, feeling pride in your accomplishments, learning new skills, honing the ones you have, and then practicing gratitude and for things in your life, the positives that are in your life, and engaging, if you have a spiritual belief, engaging in meaningful spiritual practices. So this is a long list of things to do, and obviously thinking about which ones would make sense for you, which ones are doable for you, you do or you'd like to try, and then create and structure a routine in your life that supports you in being able to do these things. Specifically in the workplace, self-care is important. So again, it's like setting yourself up for success, setting reasonable expectations and reasonable standards for yourself, and then dividing things up into concrete, achievable, doable steps. It's also important to take care of yourself at the workplace. So boundaries and limits, again, are important. You may not, think twice about working every evening and weekends, and what you should be doing instead to take care of yourself. Connecting with people at work, both colleagues in the workplace and then also participating in any social or wellness activities that may be offered at your workplace or at your school. Advocating for yourself, and which is hard. So getting support to do this, knowing that those resources and knowing all the resources in the workplace. And then finally, working in a way that supports you, finding the positives in your job, and starting the day, the things that may or in your schooling that why did you want to, what brought you there to start with, connecting with that, and starting the day or ending the day with a success or an opportunity to feel productive, so that makes a big difference in sort of our sense of well-being. And scheduling breaks, finding ways to take breaks and using them in ways that renew yourself. So that's a long list of self-care strategies I've thrown out at you, and I'd be interested in hearing from people for a minute or so in the chat, some of the strategies that people have found that they use. If you want to just stick in the chat things that you might be doing, so we can hear what a range of people might be doing. So, cooking, a fun recipe we have. Yoga, getting involved in the community, reading, walking, reading, taking mindfulness journals. They're going so fast and furious, learning, walking, fishing, yoga, training a dog, art classes, dancing, painting, music, outside, decorating your workspace, creating an environment. So we have arts, activities, practice, food. So combinations of putting away your work phone, yes, setting down electronics, quilting, journaling, crying, letting the emotions out, working out. Yeah, so thank you for sharing all of those and more. So that's another great source, is learning, getting ideas from other people. So there are a lot of wellness strategies that we can do and try and do and add into our lives. But sometimes the down feelings just last a really long time, or the experience becomes so painful, so distressing, and so all-encompassing. And our ability to function, to take care of ourselves, to participate in our life is impacted and impaired. So I want to say from the get-go that if any of these things are present for you, additional supports and resources may be needed to help you. So we're going to talk in a little bit about resources, but first, let's talk a little bit about the impact of depression or depressive symptoms. So the first thing that depressive symptoms can do to us is that they impact how we think and how we feel. Depression, we think of it as a mood disorder, and we think of it as an emotional experience. So we have feelings of hopelessness and helplessness and despair. We feel worthless and shame. We feel a lot of self-hatred. Our ability to think is impacted, as well as what we think about. So it's harder to think and concentrate, and the thoughts tend to focus on the negative and the self-critical and the self-blame. Energy, we have a lot of loss. We lose energy, we lose motivation, we may lose interest or pleasure in things. And ultimately, it leads to a lot of suffering. Now, people have described the emotional and mental pain and anguish of depression as feeling very much like physical pain at its more acute places. So in addition to impacting how we think and feel, depression can impact our ability to function. Avoidance behaviors are very common. We pull away from both the stressors and the things that support us, like friends, family. So it leads to isolation. Energy levels change. We may slow down, or we may speed up and get restless. Somatic complaints are common. GI tract, headaches, medical problems can be exacerbated. Sleep is impacted. We have difficulty falling asleep or staying asleep, or waking up and staying awake, or sometimes all of these. And then ultimately, depression might lead to thoughts about death or suicide. So if you or someone you know is struggling with death or suicide, get help right away. There's a link here to Suicide Prevention Lifeline. There's a great talk on the OITE YouTube channel about that, which is mentioned in the resources. Turn to someone you know, but don't wait. I think suicidality needs to be addressed. So in terms of addressing and treating those feelings, that experience of depression or depressive symptoms, so we said it's a team collaborative approach. So we've talked about self-care strategies. The next part of the talk, we're going to talk about professional care and treatment methods or modalities. And we're going to be hearing recordings of from 3 people that are listed here about strategies for working with trainees and students with depressive things. And then we're going to hear about workplace supports. And then we'll come back and talk briefly about things that we can do when we're supporting someone else. So first, we're going to hear from Sarah Hunter, who is a wellness advisor at OITE.
My name is Sarah Hunter, and I'm a licensed marriage and family therapist here in the Washington, D.C. area. I have a private practice and also am a wellness advisor with the OITE team at NIH. When I meet with trainees, I hear a lot about when they're struggling with depression or depression-like symptoms, really just difficulties with motivation, getting started. Some of them talk about feeling really disconnected from their work in a way that they haven't previously felt, right? They've otherwise felt really invigorated and excited and driven by their work, but kind of they're in this new place where they feel some disconnection, maybe some difficulty concentrating, and just sometimes a sense of like shame and guilt for having those experiences and not fully understanding them. And this when we experience these symptoms of depression, and the shame and guilt that can accompany it, we tend to withdraw or isolate, which really in turn just can heighten these symptoms and really create this really unhelpful negative feedback loop that trainees are often trying to get themselves out of, but don't really know how. Depression can often impacts our sleep, it impacts our hygiene, it impacts our eating habits, it impacts our cognitive capacity sometimes, and how we express the many emotions that we feel throughout our day. And all of these, like you said, can impact how we show up at work and the ways that we're producing or not producing. In a wellness meeting, really, my first goal is to create a sense of safety and trust. And I do that first by understanding who is this human, this person sitting in front of me, not just through the lens of their problem, but as a whole human. And I do that by listening to what brought them to where they're at, right? What are their interests? And so just getting to know them as a human, as a not just, like I said, through the lens of their problem. So creating that safety first, and then really assessing what it is that they're struggling with, and assessing how that's impacting their work and their life and their well-being. We talk about what is working for them and what's not working, and what are the things that they've tried to mitigate some of the problem. And equally as important to kind of really zoning in on the presenting problem and how it's showing up in their behaviors and their thoughts and their feelings and at work, is to assess what are their protective factors, and their sources of supports, because these will be important things that we lean on through kind of the care plan process. So after we've done some of the assessment, I'll move towards psychoeducation. If we're talking about depression, really helping them understand, what does this often look like? What are the symptoms? And then giving them tools, evidence-based tools to address some of their immediate stressors or struggles. And then together we create a plan to address their presenting problem. And this plan, in addition to implementing some of these new tools, can be about connecting with resources, both informal and formal. So connecting with a therapist, if that's appropriate and something that they're interested, a psychiatrist, and depending on the assessment, right, and the intensity of the problem, right, really connecting them with resources that match their level of care and need. So that might be something on this end of the spectrum, right, where they need maybe some more intensive outpatient or even intensive inpatient, to the other end of the spectrum, or it might be connecting with, say, skills or support groups that we offer at OITE here. And then once we connect with resources, I'll follow up with folks, right? So I don't just kind of, it's not one and done and leave you to figure it out, right? We connect, we follow up. What skills are you working on that are, what's working, right? And what's not working? What connections in terms of resources have been helpful? What barriers are you running into? And just helping really problem solve and support in the process. Because like I said, depression can lead us to a place of isolation and shame. And so helping them see that this is not easy, just because you have the tools, implementing them is a whole nother ball game, right? And I'm here to kind of be a support in that process. People so often, and they say, gosh, I wish I would have talked to you 6 months ago, right? I could have been way better off. but really they report just feeling a sense of shame in their struggle. I think the biomedical research field can be highly competitive and intense. And so to acknowledge any sense of struggle is hard. It can be a hard thing to do. And so I think just having conversations like this, right, doing the mental health series can be a great way to say, wait, right, depression is something that people struggle with, and it isn't something that you either have or you don't have. It's often on a spectrum, right? So you can have depressive symptoms without being depressed all the time, and that doesn't mean that you that reaching out for help means that you're weak. And that's a message that I hear a lot, is like, I should just be able to get through this. I hear a lot of comparisons that aren't necessarily grounded in facts, right? So people comparing to colleagues or peers, perceiving others as doing everything well and without struggle, but they don't often know what's happening kind of behind closed doors, right? And so having that comparison of everyone else is getting it right, why can't I, can be a barrier to people saying, wait, I might need a little bit extra help here, and reaching out for support. What I often find is people come to meetings with me and they don't even have language to say, I'm feeling overwhelmed or I'm feeling sad, right? They really struggle to find that language because it's not something that we always talk about, right? And so the more that we can kind of have these conversations, it doesn't make it more prevalent or more possible for someone to experience depression. It just gives people the opportunity to say, oh, I have some of that. I might need some support here.
So another resource or member of your support team might be a therapist. So we're going to hear from Jen Wiggins.
My name is Jen Wiggins. I am a wellness advisor in OITE. By training, I am a licensed professional counselor. Outside of my work as a wellness advisor, I also run a small private practice in the DC area, and I also am a guest lecturer at Georgetown University in their Justice and Peace Studies department. Think about therapy as it relates to its ability to really help with depression or depressive symptoms. I really start with the therapeutic alliance. You know, the relationship that any person can have with their therapist really serves as a foundational point for them really digging into some of their thoughts, behaviors, and emotions that they deal with on a day-to-day basis. So the therapist serves as a sounding board for you to navigate some of your past experiences, some of the things that you deal with like cognitions on a day-to-day basis, some of the trauma you might have experienced, so that you can then think about, you know, how does this show up in my life? What are some of the symptoms that I find challenging? What are some of the behaviors that I want to improve to really change the quality of my life? And then I go into this piece around, you know, what does it mean to identify that and have someone to be a part of that process with you? And, you know, sometimes vulnerability comes into play. Sometimes we think about how difficult it might be. But when you talk about maybe some of your sadness or some of the lethargy or feelings of self-worth that are compounded by some of the depressive symptoms one might experience, therapy can be really great for that. You can think about how your goals can serve as a scaffolding to head in a direction of thriving or flourishing for yourself. The therapeutic alliance also then serves as a space to develop techniques to help cope with some of the symptoms that you're experiencing, so that you can feel connected to yourself, to your work, to people around you, and also make sure that you're feeling like you're heading in the direction that feels well for you. I think it often feels very foreboding to find a therapist, right? You know, first you start with, where do I even start? And so sometimes you can think about using your health insurance provider as a network for providers that are a network for you. You can think about using something like psychologytoday.com. There are also other websites that speak to nuances of people's identities, for example, therapyforblackgirls.com. But then you get to those websites and you see all the profiles and you're like, okay, how do I even choose? You want to find a space in which you can feel comfortable with a person. And so you want to think about what kind of safe space do you want to be fostered? And so what might that person look like? Where might they come from? What treatment modalities might they use? and then also what's their therapeutic style. So when you think about therapeutic style, this might be anything from their personality to their level of communication to how active they are in working with you individually. You want to think about maybe demographics. Is there a certain person or age or religious background or affiliation that you might want to consider? So for example, if you are a person of color, you might want to see someone that looks like you because of a multicultural competency piece, or it might be where you feel the most comfort, right? Or if you want to think about what is it that you really want to focus on, not just the depressive symptoms, but what are some of the things that might have contributed to it, or factors in your life where you might want to say parenting stress or career stress or trauma history. And so you want to think about what that practitioner's expertise might be to lend itself to be a good alliance for you. I will say starting therapy can be sometimes difficult. And so I often encourage people to give it 2 or 3 sessions, because in your first session, it's a lot of discomfort around, I'm sharing a lot of personal things with this new person to me. And sometimes that can make you feel like, oh, this is not comfortable. This might not be a good fit for me. But by doing 2 or 3 sessions, it helps you discern if something is a good fit for you versus your emotional response to being vulnerable and sharing in a therapeutic space. And, there's a lot of nuance to some of the things that folks in the biomedical research field explore in therapy. And it's okay to really look for a therapist that has a specialty in that or has a history of working with folks in the community. But if we come from a community where things around our mental health or our mental illness or being vulnerable about those things, we are told not to share those, right? And if that is a message that I have received, I'm going to be a little bit reluctant to go into a space and share all those things with someone that might feel like a stranger to me. And so I encourage people to think about, that stigma that we feel sometimes silences or stops us from being able to say, I want to tackle these depressive symptoms. I want to manage my depression more effectively, because ultimately this is all about quality of life. And how do we think about, okay, I want to feel more pressure to live a better quality life than the pressure to kind of hold on to this and keep this silence. But sometimes that's often connected to our feelings around strength versus weakness. And you want to say, I'm an avid believer in my strength is only shown through me acknowledging my weakness and finding supports for myself. But some other barriers that folks might face could be time. We are often working, again, thinking time is working against us, but finding a space and we're saying, 1 hour out of my day is what I would have spent scrolling on TikTok or watching TV that was not beneficial to me. But to find 45 minutes to an hour to check in with someone has the ability to really have a great impact. Or thinking about other responsibilities. We often are focused on things like our work or other external expectations from family or friends, other professional or academic obligations. And we forget that we too need to have an obligation to our own self and our own wellness. So the ability to prioritize our own self can be a barrier that we face. Sometimes we think about, being able to say, should I be doing this? I should just get myself together. I know what I need to be doing. And those moments of the should statements that are connected to our cognitive distortions can pose as a barrier. So I encourage people to want to minimize what you should be doing and really sit with how you're feeling and how you're functioning and being grounded in that, and use that as a leverage to say, I actually want to talk to someone about this. And it's about managing our mental health and wellness. I often think about it like, what are the puzzle pieces that help us sustain and maintain? And each one of those things can complement one another, right? And so let's say I am doing psychotherapy, but I also really value feedback from a chaplain, right? A spiritual advisor. And I might want to add that to my support team or my treatment team. Or I think about adding, potentially a psychiatrist to my treatment team, which, you will hear about as a part of this discussion too. Sometimes acupuncture, right? We know that stress can manifest, we know mental health can manifest in our bodies, and having that physical outlet through acupuncture or yoga or even biofeedback treatments. And so thinking about what works for you, right? What's nice about mental health, it is unique to us, even though we feel the similarities of what other people's experience, but your treatment should be one that you feel comfortable with, it feels accessible for you, and it speaks to your cultural and personal values. thing that I think the pandemic has taught everyone is that anxiety and depression are very common, and us at baseline that we're all having similar experiences, right? Even though they're unique or have nuance to them. And that's when group therapy or support groups can be really helpful. So to be able to sit in a room of peers, for example, LITE, we have plenty of health and wellness groups in which, folks within the community can come together, but to have people with similar backgrounds, similar experiences, to hear from them and how they have been coping, it feels nice to be seen and heard to say, oh yeah, I feel the same way, when you might have thought you were the only person feeling that way. That support group of people, that people who are also following your health and wellness, also helping you be accountable for your health and wellness, can be really helpful. You deserve to be managing your symptoms. You deserve quality life and living. And, the more you pour into your mental health and wellness, the more optimum you can be as an individual, as a scientist, as a researcher, as a medical practitioner. And so when you pour into yourself, you pour into your future.
So thank you, Jen. So the next person we're going to
My name is Jen Wiggins. My name.
Sorry about that. The next possible person on your treatment team could be a psychiatrist, and now we're going to hear from Ana Ordonez.
My name is Ana Ordonez, and I am a child and adolescent psychiatrist as well as an adult psychiatrist, and I work at the NIMH. I actually used to work at the intramural program. I was a trainee at the intramural program as a postdoc many years ago, and then worked also as a staff scientist in the intramural program a number of years ago. And now I'm working in the extramural program at NIMH, and I also still have some clinical care hours that I do. So I still see patients as well. Medications are another modality that exists to help treat depression. They can be very effective, and they can be used as the single modality to treat depression. So you can start with that modality in some instances, or they can be used in combination with some of the modalities you've already heard about. So they can be used in combination with psychotherapy. The primary medications that are currently used to treat depression, which are commonly known as antidepressants, are from the family of selective serotonin reuptake inhibitors, otherwise known as SSRIs, or selective norepinephrine reuptake inhibitors, otherwise known as SNRIs. So there are two families of medications that are commonly used not only to treat depression, but also to treat anxiety, which is, anxiety sometimes comes hand in hand with depression. So sometimes people feel some relief, not just from the benefits on depression symptoms, but also on anxiety symptoms. Some of the common names that you might think of in SSRIs are things like Prozac or fluoxetine, sertraline, citalopram. So these are, if you do a Google search on SSRIs, you'll find lists of different names that might ring a bell, for different people as something they may have heard about. Psychiatrists are not the only ones who can prescribe these medications. So actually a lot of primary care providers feel comfortable evaluating people for depression and can be the first line of treatment for treating depression and anxiety with these medications. So if if this is something you're considering, a good place to start might be to reach out to your primary care provider and talk about how you're feeling and whether this is something that might be helpful for you. There are a lot of additional kind of other types of medications that can be used to help treat depression. So as I was saying, there are some standard kind of first line treatments, usually what we would consider that people would, is the first thing people try. There are a different number of medications. Sometimes people need to try different ones to find the right fit for them, the one that works the best and has the least side effects. Often these other types of medications like ketamine are things that, if those first line treatments are not working, that people can discuss with their doctor as alternative treatments, something to try after you've tried these first line treatments first. In general, I would say that's the way that people are thinking about those medicines. But there are a lot of new treatments that are, evolving, not only medications, but other types of treatments. And so if those first line treatments are not effective, people should definitely talk to their doctors about some of these other alternative treatments. Deciding when the right time to start a medication can vary, in every individual. And it's really about, I think, what I would encourage people to know is that we have treatments that can really help. We know that antidepressants take a little bit of time to start working. So for some people, it may be 2 to 4 weeks. For some people, it could take even 6 weeks for the antidepressant to start working. And we know that not everybody gets the same benefit from, you know, one antidepressant versus another. And so sometimes it takes more than one try. And certainly you're always measuring the possible benefits from the treatment versus side effects and risks of taking any treatment. And that's the conversation you can have with your healthcare provider to help guide you as to when might it be a good idea to try some of these options. Different types of interventions, that we think about it as different levels of care. So, you know, the least involved level of care might be to see, you know, a doctor once a month, or it might be to see your therapist once a week. So those are outpatient levels of care. And those can increase in frequency. So you might see, if things are not going so well, you might see your therapist twice a week, or you might do therapy and a group therapy and get, you know, do some skill building. And then that can go up, right? So if things are really not going well, you might try something where you're in outpatient care every day for a certain number of hours. So maybe 3 hours in the afternoon. So those are the kind of things like described as intensive outpatient programs. A lot of the time they're at the end of the day, so people can, you know, do other things during the day, and then they spend 3 or 4 hours in intensive treatment 5 days a week or 4 days a week. And from there you can go up. So there are programs that might be more hours in the afternoon, and then there are programs that might be from 9 in the morning to 5 in the afternoon, which we think of more like day treatment programs or partial hospitalization programs. And then the highest level of care is when somebody, you know, might need 24 hours care. So they might be in that we would consider that inpatient care, where they stay overnight in a hospital and they're getting 24-hour care. And those days tend to be for, you know, usually it's to really stabilize symptoms. They tend to be not that long, right? From days to a few weeks. But I would say the majority of the treatment people receive over time tends to be in outpatient, and one of those other iterations of outpatient care. So many options out there. It's really about starting a conversation and getting more information about what might be the right next step for you. So reaching out, talking to your doctor, and starting that conversation, and you don't need to have decided before you reach out to your doctor that it's time to do something. It's really, you know, if you're in a lot of distress, if these symptoms are really getting in the way of your life, it's the right idea to have a conversation with someone who can give you some more information and help guide you as to what the best next step might be for you.
So thank you, Anna. So now you heard from 3 different kinds of mental health providers. You may have thought about what you want to do, and now you need to figure out how to adjust that, how to make that work in your work life and your student life. So we're going to hear from Sharon Milgram, who is the program director of OITE, but she's going to talk about ways you can get support or interface with your school or with OITE.
Thanks. So I'm Sharon Milgram, and I direct the Office of Intramural Training and Education at NIH. And I've been a mentor to students here. And in my prior position, I mentored trainees at University of North Carolina, Chapel Hill. So in the 2 settings that are mostly represented here in this audience. The first thing I want to talk about is having a conversation with your PI about what is going on, because I think that adds a tremendous amount of stress to the stress of struggling with health and mental health conditions. So sometimes you're at a point where you have support, you've lined up a therapist, you have a healthcare provider who's supporting you, and you need the ability to meet once a week, sometimes maybe 2 appointments a week. And what you need is permission/notification, right? And I stress notification, not permission, because I want to make the point that we all have the right to take care of our needs during the workday. So what you really are looking for is to let your supervisor know that you're going to be out. For example, I just want to let you know that I have a standing health appointment every Tuesday and I'll be gone for an hour. I'll be working extra hard Tuesday morning to make sure it doesn't impact my work, right? So just a notification. Now, sometimes you do need more support. You might be really worried about your performance. You need to have a more in-depth conversation. Now, depending on your relationship with your PI, you might feel very comfortable going in and saying, I want to let you know I'm struggling right now with depression. I am getting help, but I know my productivity is down, and I wanted to talk with you about that. That may seem like a conversation you can have, and if so, that could be really important so that you have support from your PI during this. But it may be that you are really stressed about having that conversation. And in that case, you want to get guidance from others before you go in. And we all know there are very supportive supervisors and really less supportive supervisors, and some you don't know well, so you're not certain will they be supportive or not. If there's any uncertainty, find a program director, the director of your graduate program, your postbac program, a staff member in the Office of Postdoc Services, an administrator that you feel you can trust, and ask for a private conversation. Tell them that you want to go talk with your PI and ask for some advice on how to do that. You can even practice, right? You can even think about the boundaries, what you want to share, what you don't want to share, right? Because remember, this is a professional space. So there are parts of this situation for you that you might not want to talk about at work, and that's your right. Those administrators can provide a lot of support as you get ready for these conversations. Another place where administrators can play a very big role, directors of offices like mine at your institution, they can play a really big role if you've talked to your healthcare providers, you have done what you can using the outpatient services, and you need something more intensive, whether it's an intensive outpatient program that will fill your full time for several weeks, or a hospitalization or a medical leave to work on the sort of intersection of your mental health and health issues. If you need a longer leave, this is another place where you can start by talking with program administrators. They can tell you what policy is. They can talk with you about any required paperwork. While there may not be paperwork for a postdoc, there is sometimes paperwork for postdocs and often paperwork for graduate students because you're enrolled in an educational setting. Administrators will know what paperwork is required. They also can help you explore your rights as part of the American with Disabilities Act. They can make sure that you get the reasonable accommodation that you need. Sometimes you go to an administrator who isn't certain. Don't assume that means there's no one there who can help you. Ask if there's someone else you can talk with, right? Make sure that you find all of the potential resources possible at your university, because the more you understand upfront, the more you can manage the stress and the anxiety around needing to take leave. And so I would say that the gamut in dealing with this is from talking with your PI, setting appropriate boundaries, getting support for those conversations when you need them, understanding your rights, and taking care of your healthcare needs, and knowing who all of the people who can help are.
So now we've heard from four different people who might be on the wellness team, the support team for someone with depression. So what if you know someone at work, or a friend or colleague who's struggling with depression? How can you be helpful to them? So the first thing to remember is you are part of the team, and not becoming the whole team, not trying to be their therapist, their advisor, their psychiatrist. So keeping that in mind, sort of staying in your lane with this, and what specifics of that obviously depend on your relationship. Is it a family member? Is it a work colleague? Is it a friend? But in any case, across universally across helping someone is to demonstrate caring. Person with depression feels very unlovable, and so caring about them, being willing to listen and talk to them, showing your concern, compassion, patience, and understanding, and doing it in a non-judgmental or blaming way. It can be very hard because depression is very slow to move, and we start to feel frustrated. As the person is feeling frustrated with their depression, you may start feeling frustrated with them. And so trying to find the positives, the accomplishments, the progress, both supports them in giving positive reinforcement and keeps you in touch with the positives as well. In practical ways, you might be able to help them reduce stress in their life. If it's a work colleague, you certainly at work, personally and otherwise, and staying connected with them, as they may find that, as I said earlier, depression tends to lead us to isolate and pull away. So being sort of more active in keeping connected, encouraging them to reach out for treatment, support, help. You've learned some of the different possible resources that they may have. If it's appropriate in your relationship, expressing willingness to help them connect with resources, and being gently persistent, because depression will slow them way down. And so you may be part of the process of keeping them going. As we have mentioned, and we're not going into any detail about this, but suicidality can be an element to serious depression. And so assessing suicide risk, not being afraid to ask them, and immediately seeking help. And there is, as I said, a great a talk in the prior mental health series, and there's a link in the resources to that talk, which can give you a lot more tools about how to deal with that and how to support someone who may be feeling suicidal. And then ultimately taking care of yourself, practicing your own self-care, and setting limits on when, how, and how much support you want to give. Putting on your own, you need a life vest. We don't want you both going down together. So being able to take care of you. So we're going to end the presentation part of this by hearing the story from a person who was a trainee at NIH and has gone through their journey with depression.
Hello, I'm Andrea, and I did my PhD in chemical engineering and my postdoctoral fellowship at the NIH. And I focus on receptor and drug interactions. And now I work at the NIH in supporting science and education. So while I was a postdoctoral fellow, I was diagnosed with depression and anxiety. And I really, we don't have any family history on depression or being diagnosed with depression. So this was very new. And it really felt like a black cloud would follow me every day, no matter what I would do. And it really felt like it would never go away. And I am a very positive and uplift person, always happy. And this was a very different experience for me. And I didn't want to leave the house. I tried to keep everything to myself, and the productivity in my work really decreased as well. And the main factors that contributed to my depression, because the main one was the death of my mom in 2015. And I really didn't know how to handle the sadness. And I tried to a little bit ignore it and keep going on with my life. And after that, some social stressors and pressures as a trainee also impacted the depression, impacted and really, in particular, the not knowing what was next. In my postdoctoral fellowship, I was looking for the next position and not knowing whether to go into academia or take a very high stressor jobs while going through depression. So it was a lot of uncertainty. What helped me go through all of these was really reassessing my career goals and what was important to me. And having people around me that care, and opening up and looking for help, so therapy, medication, and it took some time, and really I never gave up. I spoke with people that went through this and gave me hope that there was another side apart from that cloud, that cloud would go away with time. And I think that gave me hope, and reaching out to mentors, career counselors, and wellness advisors as well. And then through therapy, I learned a lot of coping skills, and in particular, journaling helped a lot, and art, and expressing myself, my feelings through art as well. So there's a lot of things, and it took, as I said, it took some time, but mainly not giving up and having supportive people around me. And now really this experience changed how I approach life and my career. Now I focus on my well-being, and I know that to do well, one has to be well. And so that's my every day. My goal is to just take care of myself, focus on my well-being. And I have now every day I do a lot of what I call maintenance coping skills, like meditation, mindfulness. I try to be present, so I try to not have my phone, and be present with my family every day. And I take walks. I call them the joy spotting walks, where I walk around and really pay attention on what brings joy in my life. And gratitude journaling. I try to do that every day, and I still continue going through therapy, and now a big part of my my well-being is also to give back. And I run a journaling groups, and I express myself, and I write about my triggers, and I paint, and I do art about what was my triggers, and I try to understand them more deeply. And now I give back by just sharing my story, and hoping that this will help people going through something, some depression or anxiety. In my experience, my depression really started with deep sadness and not tackling uncomfortable emotions and feelings, and it really got to the point that I needed help, and it was impacting my work and my family. And so I do encourage, if you are struggling with depression, to reach out. So just know that you're not alone, and that many people struggle with anxiety and depression and are willing to help. And just for me, sharing and being open really was the path to getting better. So again, you're not alone, and you're struggling with anxiety and depression. Reach out for help, and people are out there willing to help and support you. Hello, I'm Andrea.
So reaching out for help can involve contacting the people that we've heard from. It can be resources. Again, the suicide resources are really important if you need that. Also, again, I want to reiterate that OITE has a wonderful access to these talks, coming to the publicly available webinars on YouTube, and particularly the suicide and biomedical research communities, which I've listed there. Another option is the supplemental sessions. Each month we do those, the ones on depression that are coming up, mindfulness hour and journaling. And you can participate to the extent that you are comfortable. That's welcome. The tentative schedule for the remaining talks are coming up. And following this, we'll have a small discussion group. If you or someone you know is feeling down or struggling with depression, please come and join, share experiences, have a chance to not feel so alone, and discuss strategies and support. And then finally, we have an evaluation, which we encourage as part of our mental health series. So click on this. So now we have question time.
Great. Thank you, Annie. I'll go ahead and help a little bit with the questions. And also, Jen, if you can put the link to the small group discussions, I don't see them up here in the deck. So I just want to, great, thank you. I just want to clarify one thing. There's some questions in the chat around specific NIH resources, the staff line, the employee assistance program, some of the OITE resources. What we tried to highlight today were resources that would be helpful for the broader NIH community and the broader biomedical research community, and not specific internal resources. In our email out, because there are some questions about what's NIH, what's not, we will try to clarify some of that. And I apologize for some of that lack of clarity. I will just take a few questions and then move to the small groups. One goes all the way back to the beginning, Annie, when you talked about treating yourself like you would treat a friend. Somebody saying, you know, I really get that, sounds great, but it's harder to actually do. So I wonder if you could give some tips for people around that.
Yeah, and I think that's really important. It's easy to say these things and it's really hard to do them. So one of the things I recommend is first to start out and think, what would I do for a friend? Kind of have a goal as to how you might want to treat yourself. And then to look at, like, what are my beliefs that are getting in the way of that? Often it's cognitive distortions. It's kind of the, yeah, but I don't deserve it. Yeah, but they're a good person, I'm not. Yeah, but. And so one thing that might help with that, therapy can help with that, but also going to one of the Becoming a Resilient Scientist talks that help you address cognitive distortions and may help you learn a lot of the skills about being a friend. We can't do everything in any one program, so those are publicly available. The things that I put on the resources are publicly available.
Right, thank you. Another question that launched from there was that for some, there is awareness that suddenly things are getting harder. I'm not feeling myself. My healthy habits are drifting away and I'm ruminating or getting more caught in less helpful habits. And what might be helpful at that stage where there's some awareness of, wait a minute, I need to do something. But even at that point, it's harder to make change. And if you have thoughts about how someone could, what could be done in that moment,
And depression is very cruelly undermines our ability to access the things that will be helpful to us. So even as we're recognizing it, it becomes harder. I think as you recognize that, if you can reach out to somebody outside of yourself, whether it's a friend or a family member, could be someone at work, if you have a therapist, or go to wellness at your school or something, because you may need their engine and their support to do it. So if the one thing that you can do is reach out to somebody, so that's one possibility. Another is just taking a break, getting up, going outside, doing something that interrupts that negative cycle of where you're spiraling down. It's physically changing how you're sitting, doing, being, and putting yourself in a constructive and healthy environment. Turn to a pet if you have a pet. Doing something that may, however small it is, that may give you some positive, which will allow you to be able to do the next step that you can.
I think something maybe really important for everyone to do is to have those go-to strategies, right, listed somewhere. I mean, all of us struggle, and it's really helpful. Just like we have an emergency plan and we run out and buy toilet paper before it snows, right? That we just sort of know, here are some things. But I think a second thing that perhaps could come out of this is that everyone sits and thinks about the institution they're at, right? And what are my resources at my institution? Is there an employee assistance program? Is there student behavioral health? Is there a wellness coach for grad students or postdocs? Does the Resilient Scientist series happen here? Are there well-being events, clubs, et cetera? And I wonder if all of us reconnected with our resources, it would be easier to reach out in the moment because we wouldn't have to do a lot of digging, and we might get over that hump a little bit better. So maybe we all need a mental health emergency toolkit.
I think that's a brilliant idea. And I think also putting on that are, think about the people in your life, the personal people in your life. Who might be a good person to have on that list for me? You know, this person may be the most fun person, but maybe they're not the best person in those moments. So, you know, consider your personal resource list as well as your institutional one.
Yeah. And so one last question. I think that many people appreciated a little bit of a discussion of therapy from an insider perspective. It is so scary to consider starting therapy. Not only that, it is financially difficult. Insurance is confusing. Figuring all of it out is really a barrier. And so there are a couple of questions about, you know, what if therapy doesn't work? How do you know when it's time to stop? If you feel you need more and your therapist is saying, oh, maybe you're done, just a little bit, if you could explain how important it is for us as individuals in therapy to ask questions and tell our therapist what we need. Because I think some of that is underlying those questions.
Yeah, and I think, you know, as Jen talked about this in her pieces, is you are the consumer, you are the user in the therapy relationship. And so it is supposed to work for you, and also to give it time to try, but ask for what you need. And if it's not working, and if you don't feel like you can talk to the therapist about it, they may not be a good fit. It is a personal relationship, and not every therapist is the right person for us. Now, I am myself a mental health provider, and I absolutely believe in the power of therapy. And so maybe being able to have that conversation can be part of your wellness, or it can be part of figuring out, okay, if this isn't a good fit, maybe your therapist can help you find someone else, or the wellness office at your school or NIH, or just asking around to find a better fit for you, or a better arrangement with your therapist about what might be helpful. But you are the expert on yourself. They have expertise on mental health, but you are the expert on yourself. So advocating for yourself.
Great, thank you. Unfortunately, I just noticed there's also a lot of questions in the chat, and I think we won't have time to get to them. I was reading out of the Q&A. So I'm sorry that there are some questions that aren't discussed. There's some questions about how to talk to people you care about their mental health, and hopefully we'll be able to attack that a little bit in the small groups. I just put the link for the small groups. Please go ahead and get that out of the chat before we shut down. And note to myself, I will make sure to put the added link there. I would like to encourage everybody to make a list of their resources. I think that one of the things that, as I monitored the chat, that really is evident to me is we have a lot of confusion over what's where to go and who to talk with. And that makes good sense because people tell us that at orientation, and that's the last thing we're able to do is take in details. So let's all regroup and make sure we know where to reach out to. Please join us at the small groups. If you need a moment with one of the in between, just go ahead. We won't start till 4:15. Thank you.